I might be a little sick today. I was crying out for a doctor. I got the next best thing. No, he is, of course, a doctor, but he's a dentist doctor. The time that works on your teeth. Our good friend, Dr. Arun Narang, is with us right now. Welcome to the show.
Thank you.
So any tips? I know you're a dentist, not a doctor per se, but, you know, what should I be doing today?
Well, dentists
it's
are
a doctor,
right?
Well, different kind, right?
Rest, lots of fluids.
Same thing Mom would say, right?
Yeah.
Well,
chicken soup.
Chicken soup. Well, actually, that's what I should do. I should call my grandma. That chicken soup can, like, mend a broken bone. Huh?
There you go.
Unbelievable. Well, of course, we're talking today. Some people are very inhibited about going to the doctor and to the dentist, for that matter, and that's what we're going to be talking about today.
Yes, we are, because a lot of people, even adults, still have fears when it comes to going to the dentist, getting, whether it's a checkup or getting a root canal, but procedures have really advanced in the past 10, 15 years, haven't they, Doctor?
Yeah, you know, it's we've come a long way. Like, really, most procedures in dentistry these days have very little pain associated with it. But, you know, people are still, many of them have these deep-seated fears of visiting their dentist because of all the things, the traditional things that either they may have experienced many years ago, or, you know, they hear bad stories or horror stories about a procedure gone wrong or something.
Well, why are people so afraid to go to the dentist? Because I was one of these people at one time. I've conquered this fear, but why are most people so afraid?
Well, you know, I've put a lot of, you know, being a dentist for 26 years, I've had a lot of experience with this and, you know, put a lot of thought into it. And it really breaks down into, I think, 5 areas. Like, most of it's related to, you know, pain, cost of the work, the needle, the clinical smells, and the sounds, you know, of the drill, etc. So
well,
those
sometimes
are the
the sounds can be the worst part of things. And let's be honest, I mean, there's still, I mean, for some procedures, there's still some pain involved. But there's been a lot of advancements. Let's talk about how technology has really helped you over the past decade.
Well, absolutely. Like, you know, I think dentists these days are better trained than they used to be. There are better anesthetics that we can administer, you know, in terms of, you know, efficacy, and they're stronger, or they give us longer duration of anesthetic. So certain procedures, we can just keep the patient more comfortable because we have better anesthetic and better techniques. But also we have technological tools like the wand, for instance. It's something we have in our own office, and many dentists have this as well, where it's a computerized injection to inject the anesthetic very slowly into the tissue. It doesn't look as scary coming at you because it doesn't look like a typical syringe. And I'm injecting actually with a foot pedal and very, very slowly into the tissue, so the patient doesn't really feel the jab or the discomfort of the pain.
And that's what it is. It's usually, I mean, a lot of it is psychological, right? And so this kind of eliminates that factor, would you say?
Some, you know, again, so some of it's psychological, and some of it's, you know, just, you know, technique and or having the tools to make it less painful. So we really can. Most times when I deliver a patient an injection with this, they look at me and they said, like, well, what happened?
What just happened?
That's just very different. I didn't feel the anesthetic.
It's much less invasive.
Well, however,
really,
if you see a doctor coming at you with a big
needle,
you automatically go into that space.
I'm petrified of needles. I have been since I was a kid. And this, you know, I always kind of close my eyes even when I get blood taken because I just don't want to see it. But this, I can keep my eyes open the whole time. I wouldn't even know what's happening.
Yeah, that's true.
Wonderful.
It just works.
We're talking about the sounds and all the senses that kind of, you know, activate when we go to the dentist. Do you find that people are becoming more educated about what's around them and that's helping them a little bit?
Well, again, you know what happens is we don't have those, the sounds, for instance, of the drill, etc. Most of the drills these days are run much more smoothly and much more quietly. You have electric motors. The turbines are much more efficient and smoother sounding. They're not as noisy. But we can overcome the sounds also by giving somebody headphones to watch a movie. Most dentists will have some sort of means of distracting their patients, like monitors in the room so that they can watch a movie, or headphones to listen to music, so that you can at least drown out the, you know, any sounds that you might be fearful of.
And how much does pain and fear of the dentist play into people visiting the dentist enough in a timely fashion?
Oh, it's huge. It's huge. I mean, again, when we do win over someone's trust, you know, someone who may not have been coming in for years or very infrequently, they were just driven into coming into the office by pain, can become a regular patient who's coming in regularly for their cleanings and checkups, because you know, they see the transformation, or they become believers.
Well, it is a double-edged sword, right? Because they're afraid to go to the dentist because they feel like it's going to hurt, there's going to have cavities or what. But if they don't go to the dentist, then they're probably going to get cavities, and it's probably going to hurt.
Exactly.
Yeah, the problems
right?
are usually going to, you know, magnify or grow bigger. But it's just sometimes the fear is so great, you know, it overcomes that, and it just, people are kind of don't know what to do. They just, you know they need to come in, but then they just avoid it.
So, oh, sorry.
I was going to ask you about you know, wisdom teeth, and when you're having a large procedure like that, or dental surgery, the aftercare is also a part where a lot of pain is involved. Have there been advancements when it comes to that, the kind of the post?
Yes, again, you know, we have so many more things these days. Like you know, there are procedures where you can use lasers to improve healing after procedures, like after surgical procedures. So, because again, it's killing the bacteria in the wound site.
Right.
So then there's less chance of a postoperative infection or a problem. You can use platelet-rich plasma when you're doing surgical procedures. You're, you know, and soaking a graft, for instance, in this stuff, and it will allow for better healing. So there's all sorts of advancements. But again, sedation also, for those who are really phobic, we can, you know, most dentists will offer some form of sedation, whether it's laughing gas, oral sedation with pills, or intravenous sedation, which is like a twilight sleep, or then a full general anesthetic for somebody who needs a lot of dentistry or is very phobic.
And this all starts from somewhere. I'm remembering my early visits to the dentist, and some of them weren't as pleasant as others. It's
Really?
improved, yeah. So which is why I now don't mind the dentist as much, because it's improved. But when
Right.
I was younger, I just had a horrible time at the dentist. So how do you help the young who come? Maybe it's their first time there. It's,
Right.
these noises are new to them. The whole
Yeah.
office really is new. So how do you walk them through into the
Well,
chair?
first of all, you know, most of the offices these days are really well designed and decorated. You know, the colors are soothing, and the offices are much more soothing. You know, the smells are nicer. You know, there's aromatherapy, or there's scented candles, there's neck pillows, or cushions, or blankets, you know, to make it more comfortable.
Sounds like a great hotel.
And for kids, you know, balloons, toys, and or just making it really fun and simple for them the first time they come in. You know, just looking in their mouth, doing a cleaning, introducing them to everyone, making it fun.
Making it fun. Well, you mentioned it kind of sounds like a hotel. It's like, give me that sedation. I'm going for a nap.
Exactly.
It sounds like a nice afternoon now, right? Well, of course, thank you for being here today and really helping us break down these inhibitions and hopefully making people feel a little bit more comfortable.
Thank you.
Our in-house dentist with great information as always, Dr. Arun Narang. We're going to be back after the break, folks.